like I said, this is the webinar for December here at Richard Kim Medicine, reviewing what really regenerative medicine is and how it can help those with different issues. Over the last month, the kind of questions that we've gotten have really extended beyond back pain. And so I definitely wanted to touch base a little bit on all of that. I'm going to get started here. So let me switch over to a shared screen. And I'm doing something right here. There we go. Okay. So for those of you who are at home and watching this online, make sure that your volume is turned up, number one, and number two, the little button on the bottom left says a Q&A. You can click on this at any point in time to ask questions. I'll reserve the end of I'll reserve answering these questions to the end of the webinar. But in the meantime, hope you guys enjoy. So the focus of this is really, how do we use stem cells to solve pain? Let's start off with a Q&A from Christy B, who comes from the area code 315. And her question was, anything related to relieving recurring and persistent lower back pain due to accidental re-injury multiple times. Left her with severe nerve damage due to low back injury, causing constant numbness in the lower extremities. So for us, the way I would really answer this is yes, absolutely, we can help. Categorizing your pain as now a chronic pain, it sounds like this has recurred multiple times in sort of similar fashion. And what often happens is that these sorts of pains occur more severely, or they happen a little bit more frequently. So the sort of things that can be treated are stenosis, arthritis, degenerative disc disease in relation to this. Nerve damage can absolutely be treated. Obviously, we have a consultation and diagnosis as well that are part of an important part of understanding what's going on. The common goals for us, we all have very similar common goals, and our common goals are, number one, to avoid surgery, and number two, to stop medications, and number three, to improve our quality of life. But how do we go about achieving them? We want to achieve those with a couple of thoughts in mind. Number one, we all want to plan. We want to plan between our healthcare provider and ourselves and those involved, what I like to call the stakeholders, in order to get to that moment of pain-free. We all want these therapies to be safe. We don't want to be trying experimental things that you know, you're the first one to ever do it. And have no idea if it's going to leave you worse off than you started. We want something that's low risk, short recovery. We want to avoid the dangerous pitfalls. Here's a pretty familiar example, and many of you might be able to relate to one of these two examples here. And the first one is that we had a retired psychologist who flew airplanes for a hobby, was a runner, and this was an important thing for stress relief. The back pain, however, ended his running. That meant no more competition, no more fun, no more stress relief, and it really limited his flying time. Couldn't get beyond 45 minutes in the air, and then had to come back down. The second example here is our chef, who really enjoyed spending time with family, was in constant motion, and really felt like moving the heavy restaurant equipment was a difficult thing. It was to the point where this was affecting his work, which ultimately meant, you know, difficult work days, and then even to the point where he was contemplating changing careers. A lot of the traditional therapies were really missing the target. What do I mean by that? Well, first of all, surgery. surgery is permanent, it's invasive, it has this involved long recovery, and was not a great option. A lot of people don't particularly look forward to that level of risk. Number two, medications. Steroids typically are a Band-Aid. They weaken and they damage tissue. They repeat, meaning that if you have to repeat the steroids, it only ends up leaving you with repeat weakening and repeat damage of that same tissue. OTC stands for over-the-counter medications, and these certainly help lessen the symptoms, but the effects wear off, and so you have to repeat the dose. And not to mention, they don't really solve the problem. They really just sort of address the symptoms that you're having. So about 2 months after our stem cell therapy, our psychologist was back to running. He had not been running for many months and was happy to do so. He ran the 4th of July race that year. It was a 4-mile race. He kept to a 13-minute pace, but it gave him enough confidence to now train for a half marathon with his grandson. Excuse me. So the chef, too, was able to go back to work full-time, provide for his family. Obviously, some pretty important, very key, very, core functions to these people's lives. But how do we exactly do that? And in order to do that, you need to understand how this whole all comes together. So when you have pain, it leads to further degeneration. And when you have degeneration, it leads to further pain. And then you're, of course, caught in this, unfortunate cycle. What we really have for you is the third solution. And as the third solution, that's not surgery, that's not medications. It's important to understand that this comes with a high success rate, B, it comes with years of relief, and 3, it's guaranteed acceptance, meaning that what we apply to you comes from your own body. So it's not coming from another human being. It's not coming from an animal, a plant, from a pharmaceutical company. So you know that what you're receiving has an inherent safety to it. But what exactly is regenerative medicine? It's a new field of medicine, and the goal and the function here is to restore and not replace. So if you think about knee replacements and hip replacements, those are really to replace. And our goal here is to let you keep what you have and make that better. So we're talking about taking damaged tissue into healthy and functional tissue. That's a pretty key piece to this. The different materials that we're using to restore this include, number 1, platelet-rich plasma, or PRP, and number 2, stem cells. Now, if you see the green, the yellow, and the red circles there, if you could imagine the green and the yellow circles, it's sort of a small and medium problem, great for platelet-rich plasma. But once you step into that yellow and large red circle, the more severe sort of problems, we really then start recommending stem cells. So severity of your problem matters, which is what I'm trying to say here. This is a good clip video of how stem cells move, migrate, and attack the areas that are problematic. So red is bad and green is good. So the red is what's driving your pain, your stiffness, your sciatica. And the green are the stem cells arriving at that area and transforming that red tissue into normal underlying blue type tissue. I like to describe this as our Pac-Man problem. If you can imagine in the game of Pac-Man that the pellets are inflammation, Pac-Man eats the pellets one at a time. So let's just say platelet-rich plasma is one Pac-Man. And the idea of using many Pac-Man, let's just say in my picture here, you've got 15 Pac-Man attacking the screen at once. That's what stem cell does. And that's the strength of stem cells. And the goal here is really to beat or leave the problem behind altogether. We're talking about 5 to 10 years of relief once you've beat the game, so to speak. So where exactly do the stem cells come from? The spinning pelvis on the left-hand side is an example of the bony anatomy of the pelvis. On that back ridge right there, you're going to see that centerpiece and then the 2 sort of wings. The stem cells come from out of that area and get injected into what is the diagram on the right. So you can see where it flips back and forth between disc and degenerative disc. So we're really injecting into that narrowed degenerative disc area in order to help it promote and become a more normal type disc. So say this is what you're interested in, and then this is what you want to move towards. How does this work? Well, the first piece to this is always consultation. We want to meet with you and, either via video visit, in person, and we have a number of different offices that can help accomplish this. But after that, we like to move to an MRI. For us, an MRI typically happens here in our office in Saratoga. And that's able to help us really pinpoint where we're going to be targeting the stem cells. After the MRI, the first PRP. Soon after that, the second PRP, and then the stem cells injection, and then the third platelet-rich plasma injection. And then from there, we begin the physical therapy, the chiropractic care, the exercise. And so this is typically how the stem cell schedule runs. So what can we treat? Well, the neck and the back are pretty high targets. Obviously, it's something we see common. It's something that occurs pretty commonly in our population. Stenosis is a very common reason that we do this. Arthritis, degenerative disc disease, and sciatica. But what about the lower body? Absolutely. So hip arthritis, knee arthritis, different types of bursitis, meniscus damages, and Achilles tendon issues. Upper body, same. Rotator cuff, very common diagnosis. We see arthritis, tennis elbow, carpal tunnel. So a lot of people like to ask, well, am I a candidate? Really hard to, tell you whether you're a candidate simply over a Zoom webinar. But one way we can think about this is that if it's an area that can be injected on or operated on, it's able to be treated with stem cell therapy. So that's a pretty good way to think about this. The important element for us is whether or not you've got the diagnosis. So saying that you have back pain or saying that you have knee pain for us is typically not enough. We need to know a little bit more. So for us, it's important that we get the accurate diagnosis so that we know that the therapy is going to be accurate as well. We also happen to be the only regenerative medicine provider with our own MRI. And obviously, that's a pretty critical portion in getting this right. So what if you've had surgery? And the short answer to that is yes, we can still help. But it's pretty important to know what kind of surgery you've had, what's been affected, if you have scar tissue developing. So the consult for us, again, going back to that, is an important first step. And this is really for us to help sleuth out, help us determine what is the diagnosis, what kind of imaging might be important. And of course, like any good doctor evaluation, we want to take a full history, do our examination. The type of surgery does matter. So imagine if you've had arthroscopy or what's commonly known as a scope versus a fusion or rotator. If you've had something like a total hip replacement or a total knee replacement, there's probably not a ton that we can do to help, because again, the important parts that we need to work with have already been removed. So let's get to some of the frequently asked questions, because this tends to be where we really churn a lot of discussion. So the first question is, where will my stem cells come from? So we are a 100% autologous practice, meaning that everything we inject comes from you and your body. Nothing comes from, perinatal or afterbirth products. Nothing comes from another person, which we call allograft. Everything we inject comes from you back into you. Number two, how long before I can become active? So a fairly standard answer for that is anywhere from about 2 to 4 weeks. In general, 4 weeks is the answer, but it also depends on what we're injecting, how severe off it is, What sort of activities were you doing before we even got to that stage? So I'll say in general 4 weeks, but it can have some subtle differences depending on what's wrong. When can you also start to feel the benefits? Similarly, at about 4 weeks. Pretty characteristically, we see about, I'd probably say anywhere from 50 to 60% of our patients seeing the benefits within the first 4 weeks, and then maybe the next 40 to 50% seeing them between 8 to 12 weeks. And we have, again, a pretty good idea whether or not you've had surgery, if you've had an active lifestyle, to be able to help predict, how quickly you're going to come back. Next question. How long will the tissue stay repaired? And this is a really great question, because we get the question often, well, do I have to come back every year for this? Do I have to come back in 6 months for this? Our therapies last years, and we're talking about on the order of 6 to 10 years for many of the problems. So imagine getting something done, feeling great, and then not needing me or needing the regenerative medicine for another 8 years. So that's a pretty nice outcome from this. And then, of course, everybody wants to know, well, how well does this work? And to some point, it depends. It depends on whether we're injecting the spine versus you've had surgery. On the whole, pretty often for us, it's we like to say somewhere between 85 to 95% of our patients have a 75 to 85% improvement. And obviously that varies a little bit per person, but that's been pretty prototypical of our results. So let's get to the question and answer section here. Ken M from area code 518 asks, can my DDD be helped? So DDD stands for degenerative disc disease. And just a comment here. So degenerative disc disease and herniations are very similar phenomenon. Degenerative disc disease is this slow leak of jelly out of the donut. Herniation is this quick exit of jelly out of the donut. When it happens very suddenly, we call that herniation. When it happens over this slow leak, we call that degenerative disc disease. And obviously having one leads to the other, and then vice versa. Okay, so great question, Ken. Michael K had a involved question here. From area code 518, he said, bone-on-bone impingement of the hip, mostly gone cartilage. Bone and joint doctor wants me to wait until 55 to get hip surgery. I'm assuming not 55 yet. Stop playing hockey at their advice. Since deteriorated to the point I have severe back pain. Struggle to clip my toenails, put on socks, gain 20 pounds, not exercising, losing motivation and energy. Can platelet-rich plasma or stem cell treatments be a solution to improve back function and hip function? And the answer is absolutely and yes. So we use this not just for back issues, but for hip issues as well. So even if your cartilage is a little bit gone, moderately gone, or severely gone, this sort of therapy is great for all of those different stages. A wide range of applications in locations and severity. So the hips, the knees, the shoulders, the ankles, etc. This really is the alternative to a replacement surgery. With our technology and our methods, we really see this as a way of eliminating replacement surgery altogether. So you can do this and not have to think about ever getting a replacement surgery, not just kicking the can down the line a few years, but potentially eliminating it indefinitely. So Phyllis S. also asked about a hip, area code 310, how to avoid hip surgery on the left hip, torn labrum, bursitis, and arthritis. We really like to affectionately call this the third solution. Surgery, medications, on the left and the right. But for a lot of these described issues, torn labrum, bursitis, arthritis, these are things that we treat pretty commonly with our regenerative therapies. Richard L. at area code 315. Had an MRI performed on low back, reviewed by Krause doctor. So Krause is a local hospital network in central New York. Being told I probably need a fusion. A very experienced chiropractor friend said, in his opinion, didn't need one, looking for a second opinion at this time, trying to do research, find different options. So on top of maybe not even needing it, the downside and the pitfall of fusion, as you can see here, is that once those screws go into the bone, the disc above it and the disc below it is something we call adjacent segmental disease. And it starts to weaken the disc above and the disc below. So a lot of times you're going to have somebody who does a fusion, whether or not it's the appropriate thing, but 3 years or 4 years down the line, realize that they're having or developing back pain all over again. And what that really means is that now the disc above it and the disc below it are deteriorating, leading them to say, the surgeons to say, well, you've got to get another fusion now at that level above or the level below. Fast forward 3 or 4 more years, and then the same conversation starts all over again. So this is why it's really so important to explore your options, because once you head down that path, it's sometimes very difficult to break free of that path. So adjacent segmental disease. Okay, Phil M from the 315 area code said, can Dr. Kim's method be applied for knee arthritis? Absolutely. Again, we're talking about large joints, we're talking about small joints, we're talking about tendon issues like rotator cuff problems, we're talking about cartilage issues like people who've developed early arthritis, ligament issues, people who develop ligament issues in the ankles and the knees and the shoulders. And so this becomes quite a popular method of solving this, because again, don't need to have surgery for it. Excuse me. Patricia C from area code 518 asked the general question, how stem cells work. Again, really just focusing on regenerating damaged tissue. Anywhere you can place a needle, you'll see results in as few as a few weeks. The entire spine applies. So if you think about the neck, the thoracic spine, the low back, and all joints apply. Barbara S. asked from 518 exactly what this treatment is and involves. Jocelyn L. from our French territories above, area code 450, asking, I want to see the method you use at the webinar. And it really is this method, the idea that we can take cells from one part of your body, transplant them into another to help heal that damaged tissue. And again, if you can do this and it has the desired effect, you're talking about avoiding surgery and then potentially for years. Jenny R. from 438 asks how to regenerate the discs and the facets. So facet and disc disease are treated quite successfully. So facet joint, for those who don't know, you can see there, we're talking about a connection between the two levels of the bone. And this creates a joint just like it would create a joint in say, your hand, wrist, or even in your feet. It is subject to wear. It is subject to cartilage damage. It's subject to deterioration and degeneration over time. Let's see. So another question, Robert F. from area code 914. I'd like to know if Dr. Kim can help with cervical foraminal stenosis. Absolutely, cervical stenosis. Very common diagnosis. The term, just to put some definitions here together, stenosis means a narrowing of the canal. So normally if you have a nerve that's supposed to go through and that canal narrows, then that's obviously putting some pressure on the nerve, and that's a problem. Canals are really the tunnels that hold those spinal cord or the nerves. you got to remember that multiple things impact stenosis, including degenerative disc. So again, the MRI is important. Your history is important. Chrissy asked, just straightforward stenosis. She's from 514. The degree of stenosis, also important to remember, does not always correlate to the symptoms. So even if you have maybe more severe stenosis, it doesn't always mean that you have the same level or equal discomfort to somebody who has mild stenosis, because again, stenosis is created from sometimes facet disease, sometimes from disc disease. So it's really important to understand that. And it's important that you're then treating the level of the pain. So even the most severe and most painful stenosis, we've treated and done well with. Debbie L asked a multi-part statement here from area code 518. Can stem cell treatment alleviate chronic back and neck pain associated with spondylosis? So spondylosis basically means degeneration and arthritis of the spine, and arthritis and spinal stenosis as well. Do we accept recent cervical, lumbar, and sacral MRIs rather than repeat them? Is stem cell treatment one and done, or repetitive treatments necessary? And what are success rates? So first question, yes, very common reasons that we treat with stem cell here: chronic back pain, chronic neck pain. Spondylosis is something we see multiple times a day. Question 2, yes, if imaging is recent, then no need to repeat, but we like to try to get images within the last 6 months. But if this is not available to us, then obviously, like I said before, we have our own MRI and we're able to get that and obtain that information pretty easily. Number 3, it is in a way one and done if we're talking about anywhere from 6 to 10 years. So let's say one and done for a while. Next question of what the success rates are. Excellent. We talked about some of our success rates before, and I would absolutely apply to this. So again, what we need to know is whether or not you've had surgery, whether or not that treatment area has been treated in the past, who's tried what, and what have you, done to try to alleviate this therapy. Because sometimes some of these therapies lead to scar, lead to damage, and we need to know that before we attempt things like stem cells or platelet-rich plasma. Lina F from 617 was more of a statement here than a question. Pain-free, vital, and productive human being. Going back to our original question or original slide, what we're really looking for is quality of life and being able to think about your life with 75% or 85% less pain, how much more you're able to do, how much more exercise you're able to do, how much more traveling you're able to do is really the way we like to think about this. I can't stress enough the importance of the diagnosis here, coming in for a consultation, potentially getting an MRI. If you don't have one already, don't worry, don't wait until you have one to come in. Just come in, we can get the ball rolling for you. Robert A from 315 asks explanation how this treatment can relieve chronic pain from lumbar spinal stenosis. So we talked a little bit about stenosis before, but here's another great picture of stenosis. The center blue cloud material is the stuff with the jelly within the donut. The purple is then the thick fibers around it. The red is that inflammation. And as that inflammation swells, you can see how it's pushing into both the center yellow, and that's your spinal cord, versus the pinched, what's being outlined as the pinched nerve. So one level of degenerative disc can create stenosis in a couple of different spots. The goal here, of course, is to treat the reason why that red and that blue cloud material is pushing towards these nerves, and not just the symptoms. And unfortunately, often we see with medications and surgery, it's going to help cut away the red, but it doesn't really fix the blue encroaching cloud underneath. This is another example of that. If Dustin A. from 315 already had microdiscectomy, foraminotomy, laminectomy at L4, L5 due to a rupture and compression, leading to a sciatic nerve issue in 2021. After the surgery, PT, daily stretch, but again, daily pain. Searching for a solution, knowing that we treat back pain, but it's something that you've been dealing with. And on top of that, you've got neck and shoulder issues that have some discomfort, and each arm going numb randomly. And I'm sorry that you're dealing with that. That obviously doesn't sound much fun and quite painful. So when we talk about ectomy or otomies, that means to cut out. Here's a good picture of a lumbar microdiscectomy. You can see that dark, that sort of aqua blue tool there, removing that little piece. But do you see where that brown is disconnected? It's because they don't repair that actual site. And so the blue from underneath can continue to push out and forward. So even though you do this lumbar microdiscectomy, foraminotomy, laminectomy, you can develop that pain again. Question of not when, sorry, the question not if, but when. Because the underlying issue, the underlying disc problem has not been addressed. Obviously, with stem cells, that's not the case. We're addressing the disc issue underneath, and then therefore able to treat that brown line and helping it reconnect. Undergoing these ectomies and otomies, yes, it cures that temporary problem, but you still have a bad disc underneath. And that's why you still have pain. Absolutely, for us, neck and shoulder, very, very common areas of treatment, but obviously a little different than the low back, so it would require some conversation and again, more imaging. Warren J. from area code 518 says, does arthritis of the hip cause general leg weakness? So yes and no. This is where that diagnosis, that consultation is so important. You might have leg weakness, but is it because of arthritis of the hip, or is there something else driving it? Have to remember that nerves are wires that come from the spinal cord down to the muscle, and that muscle drives strength. So your weakness can be a result of anything leading to that nerve damage, that wire, or damage at the muscle. So how do we know? Well, this is where sometimes we do something called the diagnostic injection. This is where something like a physical exam can really help us determine, oh, this problem is not coming from your hip, this is coming from your back, or this problem is not coming from your back, it's coming from your hip. So that first few steps is really important in determining that. Patricia B. from 518 asks, lumbar spine stenosis, regenerative treatments as opposed to surgical alternatives, and lumbar spine, steroid injections. I'm going to use this as an opportunity to talk about really the benefits of regenerative medicine. Number one, it's natural, right? We're talking about no drugs, we're talking about no hardware, no foreign materials, no plastics, no metals entering your body. Number two, it's all your cells. They don't come from somewhere else. They didn't come from another plant or animal or another person. It's all yours. There's zero anesthesia. There's no being put under. That's all local anesthetics. We can numb things incredibly well and really minimize that discomfort. Talking about short downtime. We're talking about, being down a few days, if not a few weeks. And then some people, when they talk about surgery, we're talking about 6 months, a year, sometimes longer with recovery. For us, recovery is all done from home because we never enter the hospital. You leave our office and you're recovering from home, which is also another, major comfort factor for a lot of people. John H. asks, knee pain and degeneration of spine focus. Bonita W from 315 asks, expand the understanding of non-surgical intervention for bilateral knee issues and husband's lower back condition. So going back to John H. here. So in thinking about that nerve and wire and muscle issue, that nerve runs past these other areas. So what may be back pain may be driving what you perceive in your knee, and what may be knee pain or what may be back pain may be some compensation from how you're walking on those knees. So there is a little bit of an overlap. Obviously, the further and more distance they get apart, that part becomes a little bit easier to solve for. Where that becomes very tricky is where hip pain and back pain have this strong overlapping geography, and which makes sense. They're very close in terms of proximity. So for us, diagnosis is key. That exam, sometimes the diagnostic injection, sometimes the MRI, really help for us say, no, this is all spine, or no, this is all hip, or say in some people's instances, no, you've got a little bit of both. Understanding that has been a key part to both our success and your success of the therapy. For Bonita, yes, absolutely. So for people who are looking to be active and stay active, sounds like both knees and a low back condition, and you're looking to, if for example, you're exploring this to get back into an active lifestyle, absolutely. This I would say almost better than not for those who come into it active and look to be active afterwards. But again, diagnosis is key. Talking about knees and the low back, but what's actually driving that pain? Is it coming from your disc? Is it coming from facets? Is it a sciatic nerve issue? What's the deal? Tracy F from 413 says, if I'm a candidate for this therapy, I have severe DDD, degenerative disc disease, and spinal stenosis, failed injections and failed physical therapy, and whether or not insurance covers. So the candidate determination really is at the consultation, but it sounds like if you know that you've got those diagnoses and you've tried these other modalities, then coming and trying something with us is absolutely the next step. For us, it's people sometimes, not always, but sometimes start with us, but just because of the way healthcare system works, you see your primary sends you for injections, either work or don't work, and then you're trialing several things. But in your case, you've tried them, you know it doesn't work. There really isn't a whole lot left. And if you go back to your primary, you go back to your GP, they're going to say, look, it's surgery or nothing else. But that's not true. There's more options than that. And that's where consultation is important. And the question about whether insurance covers, insurance does not cover. And Andy W was asking from 413 as well, do we accept Medicare and Media? For us, our therapies, it's not us as an office, but insurance companies do not recognize our types of care and modalities. We've had numerous people try, yet to see one go through. So unfortunately, they do not cover. Okay, moving on. Deborah D from 518 said, new to this type of treatment, interested in costs and of course how long, the effects and outcomes of treatment. So our process, and this is from us really having 5 to 10 years of experience with this. We know pretty well that certain therapies last 5 to 7, certain therapies last 6 to 10. We have a good understanding of exactly how long our methods work for. There is some individuality to it. So whether or not you've got other medical issues on top, or whether or not you're active or whatnot. For us, it's also important to relay once again, it's your stem cell always. It's what we use 100% of the time, your stem cells for you. Fred J from 802, what about bone-on-bone shoulder pain? Absolutely, yes, we can help. So we treat shoulder arthritis regularly, and I can say pretty confidently over the last year and a half, we have not had a shoulder fail on us yet, even those with bone-on-bone therapy. So a pretty common diagnosis, but a very difficult diagnosis, I think, in terms of traditional therapies. You'll find that there really isn't a whole lot for shoulders. Anna D from 802 also asks, how are the procedures done? So for us, you saw the timeline before, typically done in a series of injections. Ours are all done in office. There's no hospital, no ambulatory surgery center. It's all done here. For us, 100% of the time, they're done image guided, meaning that we either use an ultrasound machine or a live guided X-ray machine. This ensures accuracy and precision. And I cannot emphasize that enough. If you're talking to some other provider and they are not using those modalities, you do not know where those cells are ending up, and then therefore changes your success of outcome. So if you are talking to anybody about even something like steroids, how do you know it's being injected into the right place if you do not see that tip of that needle enter into the right space? So accuracy and precision is everything in this. Mitzi K from 315 asks, there are always risks with any procedures and treatment, which are true. What are the biggest risks associated with what we do? How many treatments is typical? Pricing can vary. What's the typical average cost? So for us, the equivalent risk to, let's say, an epidural steroid injection or a knee injection, it really isn't different. Again, it's the same process. We are taking a single needle, going through the skin in order to inject the material. So it's really quite similar. I would almost say that our process is safer, given that we do use ultrasound, we do use live guided X-ray, so we know that we're avoiding certain structures. So in terms of that component, quite safe. For us, how many treatments is typical? Typically one treatment cycle. We do it once, and then you're good for those next several years. Costs, of course, always difficult to describe and outline, and they vary considerably. So Joe D asking from 315, severe spinal stenosis, researching treatments and remedies outside of back surgery. So what I'm going to encourage to anybody who really wants to look into this, and it's not to just read random web page after random web page. If you look at, say, more reputable pages like Johns Hopkins or Mayo Clinic, then you're going to find some well-vetted material. For those who are just interested in the science, PubMed.gov is the government warehouse where all the studies related to anything medical are published. So it's a great searching database. Ken K from 607 asks, I've had 12 back surgeries and 3 stimulators. Nothing can help my arachnoiditis and nerve damage down my back legs. Some days can't walk. Please help me. And I can tell you we can help. We've had people in very similar situations, multiple surgeries, stimulators placed, replaced, pulled in, put in, pulled out. So even in the fact that you've had surgery, even in the fact that you've had the stimulator placed, we can still help. So don't despair. I encourage you to have a consultation and explore regenerative medicine. Taryn D from 604 said, stem cells for slipping rib. So slipping rib syndrome is a different kind of diagnosis, not so much associated with the spine and with large joints, but it's obviously of the ribs, and it's where a rib can move on certain patients and can cause quite a bit of pain and discomfort. So stem cells, yes, are possible, but I would certainly start with diagnostic injections. A lot of people arrive with the diagnosis like slipping rib and saying, well, I want stem cells. And for me, I really need to be sure that that's the actual diagnosis. If you apply stem cells to a diagnosis that we're not sure about, then how can we say that the treatment's going to be, how can I sort of foreshadow any success rates with that sort of therapy? Kip M from 315 says lower back and the T11 crashed at 40%. So I'll address the T11 portion. So the thoracic spine is something we've seen quite often. And the tough part about the thoracic spine is that there's very, very few options. And the reason why there's so few options is that because it runs basically along the region of the lungs, and it encompasses the rib cage. And so there's not a lot of great surgeries in this very tight and narrow space. But you have to keep in mind it does have similar anatomy to the neck and to the low back. And so for us, getting a needle into these very tight spaces and getting them into certain locations is not a difficult thing. Catherine F. from 514 says, I need to have knee replacement by surgery. Like to avoid it, like to see this explained more. So again, knee replacements for assuming then that your diagnosis is severe knee or osteoarthritis, this would be the alternative therapy. Consultation important. Let us see exactly how severe it is. I think sometimes the knee arthritis is either not as bad as we initially anticipated, or it's worse than we initially anticipated. And so it's important for us to understand that. John H. from 703 asks, how can this address a complex tear of the posterior horn of the medial meniscus? And MRI also noted a 4 millimeter medial meniscal extrusion. So this really goes to issues within the knee. So, right, the tear is one issue, the cyst is another. The overwhelming problem is that once you develop a tear in something, then the inflammation that occurs from that is what's really driving the pain. In the therapies that we do, it really helps address the chronic developing inflammation and irritation from that tear. And then it helps stabilize that tear through the fat, through the bone marrow, through the platelet-rich plasma, so that that inflammation doesn't happen worse, or it doesn't happen further, or it doesn't happen anymore. When you go to cut out a complex tear like this, they're going to be removing quite a bit of meniscus. And they're going to say, well, we cut out the meniscus, we cut around the tear, so you don't have a tear anymore. You also don't have much meniscus anymore. And I tell everybody who will listen to me, try to keep as much meniscus as possible. It's important for the cushion effect of your knee. I understand that it's creating pain, but maintaining that is critical for the health of the knee. So, John, come on in. Let's take a look at the MRI and see what we can do for you. Martha asks, I want to be able to sit comfortably without pain, low back, burning sensation. So again, people with nerve-related issues that run down the leg, people with sciatica type symptoms. This is very typical of sciatica, and it's definitely something we address and can help. And then just not being able to sit comfortably, it's aggravating, it's annoying, it's, I can't even remember how many times we've done consultations and patients are just standing all throughout because it's that uncomfortable. Okay, so we're at the end of our question and answer section by that. A couple things I want to mention, and I'll answer a couple more questions that people are asking. So for those who are attending this webinar, happy to extend to you a free consultation. The caveat is you have to call Friday by noon. By noon, our Friday at noon, our office closes. Please mention webinars so that we understand where you're coming from, and you have to have that consultation scheduled. Our phone number is 518-871-9900. Our webpage is richardkimmedicine.com. Any of these webinars are recorded. Any previous ones are also recorded. Very similar material up front, but very different questions towards the end, as you can see. And I try to make update this every time for every month. For those who are interested in obtaining an MRI on your own, richardkimmedicine.com/MRI. So for us, because we don't participate in insurance, we have an open MRI to the public. If you're interested in MRI, the cost is $350. You can come in, do your own MRI, and then we can talk about the results afterwards. And of course, the consultation is free after that. For those in the Montreal, Quebec area, we will be doing an in-person seminar in January, and you can expect that. I wrote it down, January 31st in Montreal, and I'll continue to provide details on that as we get a little bit closer. Our next online webinar will be January 17th at 5 p.m. Same page here, richardkimmedicine.com/webinars. So I've got 2 questions and I want to get to this. David, I hope you were able to resolve the muting issues there. Number 2, Jenny R. asks, what is the difference between PRP and stem cell procedure, since the stem procedure used 3 times PRP? So great question. So a PRP is generally done in one session. So just a single PRP session. The stem cell process for us is a series of injections that has PRP at every visit. And the point of doing that is it's like preparing the ground before you plant the seed and then watering the ground after you've planted the seed. So PRP really has this additional function of helping us prepare, let's say, for example, a spine before we actually do the stem cell portion. And then we use the PRP to help address either those stem cells that were placed or additional areas that create pain, so that when we go on to do something like physical therapy, it has much better value. Our understanding of back pain and what knee pain is that it's quite limited. And we think that, oh, I see a bad disc, so therefore it's the disc, let's address the disc. It's more than that. It's ligaments, it's tendons, it's muscles, it's the nerves. There's so many things involved. And obviously we want to address and inject after as many of those things as possible in order to get the best results. It's what we now call the functional unit. And that it can be seen in an ankle, in a shoulder, in a knee, in the spine. So that's really the big difference there between doing PRP for one single injection versus a stem cell process that really is flanked by PRP on both sides. But great questions. So if anybody else has got a question, happy to sit here and answer. So I'll give you guys a few minutes. Okay. Hopefully I was able to answer a lot of questions for you guys, and you're able to see what we do, how we do it. If you guys have questions in the future, please don't hesitate to come in for a consultation and discuss further. Otherwise, I'll look forward to talking to you guys soon.